you an initial reaction to. Thank you, Kendra. We are recording this breakout session. Great, we'll get started. Carmelita.
Hi, good morning. First, I just want to say hello again, Representative McCarthy. We seem to be in all these meetings to get in the same work breakout session. But anyway, so I think my comment is I really appreciated the historical presentation that Commissioner Bai gave, because we seem to have forgotten, some of us have forgotten or didn't really know where we were. And then that other slide of showing what the teachers, directors, and the families are going through, have to navigate through with our system. So my comment is, I truly agree that we need, if I have to prioritize the recommendations, I really believe in the governance structure, because without the governance structure, we will seem to have all these recommendations, but we won't. I think we need a place wherein we can decide, what is the best way. My only concern with creating regional governance structure, appointed members, is that we need to make sure that we also have members who are practicing, who are in the field. For example, if we do put a family childcare provider, it has to be a family childcare provider who's really day-to-day encountering and experiencing all these things. And as the Blue Ribbon panel members were formed, also we had different entities. We had higher ed, we have the business people and all those things. So what I would like to see are practicing providers also in that governance structure. And then my second priority is data collection, because I like that recommendation that we need to find a way to improve our data collection system, because all the work that we do are data driven and database. I mean, I'm writing a grant now for the Department of Education, and they're asking for data, and I'm struggling to find data of the things that I need to prove why I need this money.
Right.
So I think data. And then 3, of course, streamlining our funding system, because as a director, as a previous director, just to submit a report on school readiness, annual reports on school quarterly report, then I have a report for LSI, have a report for C campus. I mean, and directors oftentimes are also in the classrooms. So, to just juggle all those things. But so those are my 3 priorities: is governance structure, data collection, and the funding stream. Thank you.
Thank you very much. Others?
Just make a quick comment. I'd like to thank Carmelita. She covered quite a bit with her comments, but I do think, some of the recurring issues we hear all the time from parents are they can't find out, they don't know where to go, they're not sure what's available to them. So I think from today's session, really streamlining the funding and having that well understood for the parents is a high priority for me, because I think once we get that established, things will start to fall in place better. But I understand, because as the commissioner said repeatedly, it's very complex. And so finding one way to consolidate all of the funding into a stream, I think makes a lot of sense. I don't know how you're going to do it, but it makes a lot of sense to me. And I think that will go a long way. And then continuing, as Carmelita said, the data is important, and looking at what we're doing with outcome, but trying to keep the parent in focus, I think, is going to be crucial as we go forward, because and working all as a unit with the providers, the parents, so they can go in and they know what programs are out there. They know what they're going to qualify for. I think this is going to be an enormous improvement if we get it right. And I think it will take a bit of time going forward. I don't expect it to happen at once, but we can continue to have that goal. And I just want to compliment the work groups that have put in all these recommendations for the panel. I mean, it's an enormous help, and I'm still learning. And I also, backing up on Carmelita's comment, it was nice to get that history, you know, to have that foundation of the history of how we got from point A to where we are today. But for today's purpose, I think the funding, consolidating that and getting that understood is a big plus. So thank you.
Thank you, Representative.
So I also want to just thank the Office of Early Childhood for all their incredible work, as well as the work groups. There's a lot in here, and I don't even think the presentation does justice to what exactly you're recommending. And I think I have some questions that I would just kind of offer for thoughts. I think the idea of both centralizing a one-stop shop is interesting, and I am curious how that is going to be held in tension with the localized governance systems. It feels like you're undermining the first strategy by creating, you know, these new things. So I think I understand, like I could see a world in which this would work. And also at face value, it feels like you're adding more stops. And I think the idea is to remove layers of bureaucracy rather than add. I'm curious about I think it was elevated, the idea of funding like class size, and really interested to learn more about that, how you all think that is going to work, especially kind of given the idea of a one-stop shop and then also these governance structures. Definitely don't want to lose sight of Carmelita's point and Representative McCarthy's point about including parent voice. We have all of these kind of parent cabinets, so leveraging existing infrastructure to me seems like it would be smart, but not entirely certain if there was more thinking around that. The data and outcomes, you know, yes to all of this. One of the things that I had noticed was the idea of making sure that there's an identifying tracking number that can be leveraged, you know, all the way through, hence the point of it kind of being localized or centralized rather at SDE. I agree. I think that is critically important. And I might offer, wouldn't it be nice if it went even through our higher education systems? So, you know, I think there are ways to do it. Other states have done that. And for a whole host of reasons that makes sense to me. So first blush, those are some thoughts.
Thank you so much for raising some of those nuances, right? And questions and places in which we potentially might be feeling some push and pull, right? And some of this would get kind of teased out as we think about actual implementation and what this would look like. But I think even at this level of the draft recommendations, we need to be having those relationships, right? And how all of these recommendations intertwine and interconnect, and how that makes the system function more efficiently, or maybe not function as efficiently. And so thank you for raising those. And I think we can see if any other members have just kind of high level comments, and maybe we can start digging into some of those pieces that you just identified, Emily. Other Blue Ribbon panel members, some initial kind of thoughts or feelings from what you heard this morning? Is there maybe anything that's missing, right? So there was a lot, I kind of heard from several of you, like there's a lot in there, but is there anything as we think about kind of our systems and how they function right now that we're not tackling? Any gaps that you're seeing? Well, that's good.
No, I see the program supports and operations, and just wondered if we could maybe dig into that a little bit more. How are we going to really look at what all the different types of supports that might be needed, and how we get that information out through the system as well? I know it's been covered, but I'd like to just hear a little bit more about how we're going to do that.
Elena and Cathy, I'm happy to jump in here if
Yeah.
it was helpful. Representative, that's a great point. One of the things we have discussed as part of one of those sub work groups is that we want to make sure that we are talking with providers to see what specifically do they need. And so we have begun that kind of at a very high level process. There are certain programs that are in place, but as we have kind of had discussion, we've talked about there are things that are in place that are not necessarily used as much as maybe they could be. And so we've talked about one, is it a little bit of an education piece of how do we get what is currently in place? How do we make sure we get that in the hands of providers in terms of what they might need? But then a little bit to Elena's point, making sure that we have the opportunity to ask what's missing and what are those gaps, to make sure that we are just not filling more things that are already there, but that we are truly kind of plugging in. And then lastly, I'll just say we've also had conversations as we think about new providers coming on, how can we get them started off on the right foot? And so that we are not necessarily backfilling what is needed after a problem or a crisis has already arisen, but how can we make sure that we are proactive and we provide a litany of support on the front end. So hopefully we don't get to that point.
If I may, and I appreciate very much that information and clarification. I know the other evening I brought up that a gap that I may be out there and we should investigate is looking at what kind of behavioral supports we have for our providers, if that's needed, and could we work toward trying to be sure, because I know through K through 12, we've done an awful lot of work there. And I'm wondering if we're doing the same, if the same equity is there across for providers in the early childcare industry. So that's one thing I think I'd like to see personally, that we focus a little bit to help our providers with those kind of issues, should they arise, and where would they go? How do they handle that? And to get a good understanding of the landscape throughout the state, where are those gaps? So thank you for bringing that up, Kendra. Thank you.
Looks like Carmelita, you have a question.
It's both question and comment, and thank you, Representative McCarty, for asking that question in terms of program supports. I think I'm talking about because I've been in the field also as a director, that one of the things that I hear the teachers complain about, not complain, but are worried and concerned, is that there's so many things that are brought to them. There's, the changes of, just an example of, from the PCF, PAF to ELDS to DOTS. Okay, that's one. The assessment, and I think we talked about this yesterday with the assessment of, do we look for one assessment for child? So it's really important. Thank you, Kendra, for explaining that. It's really important to give the programs support, but we also need to think about how much are we giving them? How much are we asking them to do? And then it goes back to compensation, which is another discussion, with all the things that we're asking them to do, that we just have to be mindful of what we give them. And then I think that's where the support is that, do we lessen what we expect from them? Or do we give them something else? And of course, the behavioral and mental health support, teachers are burned out. Teachers are going, they need those mental health day off without even using their personal day. They just need a day to just get out of the classroom and don't charge it to their personal day and sick day. It's a lot of those things that we may have to think about in terms of program support. So it's not just curriculum, it's not just, giving them new tools to work with, but really support of we're here and we understand what they're going through. Thank you.
Those are great points. And it raises in me some, right, really thinking about the opportunity, right, as we think about the consolidation of funding streams, right? They have different requirements in each of those funding streams. They have different reporting requirements, enrollment requirements, all these things that all staff at multiple levels need to be thinking about and adjusting towards and doing, or sometimes doing 2 times or 3 times, right? Because of the different funding streams that might be in one center or one classroom, for example. So, do you see the consolidation of funding streams as an opportunity for us to really think about, maybe it's a reduction, but at least definitely a clear pathway of new kind of requirements and things to do, and having that be an opportunity to really set that stage? I said of any, yeah.
Yeah, I personally, I see that, but I'm not a provider, so I defer to the people doing the work on the ground and listen intently to what they have to say. But to me, that would be, but I would like us to be able to have across the state that we know what is absolutely necessary, and it should be irrelevant to where that sort. Do you hear what I'm saying? That we have to have some sense that every program would have to have this basic priority in place. And I think what I've been saying with the mental health and the behavioral supports, all of that to me is very important, but there could be others. So I think across, even though they're different programs, different funding, if we get that consolidated, but we go from there saying, but yes, even though this funding source is different, we all agree that we have to have this basic support in place. So I don't know if that answers it, probably make it more complex, but I not knowing, think that having of one funding source does make sense to me anyway. Thank you.
Yeah, something that we heard, and I don't know the exact number, but I think, Kendra, we have it, the number of programs that have multiple funding streams and the complexity and the administrative burden of, it's kind of like a Tetris game, I think, when you're putting together your budgets, and then when you're receiving your payments, because if you're getting some payments that are made in arrears and some that are made in advance. So I think, that we're trying to simplify the complexity of the system by, going from 5 to 1, or even if we get from 5 to 2, I think we'll have made progress for the providers. And I just wanted to, if I could just touch a little on one of the questions that Emily had around the classroom and funding per classroom. You just give you a little bit more information. Right now, classrooms are not funded, or providers aren't funded by their classroom, and it at times destabilizes programs. And so, our goal is to make programs as stable as possible, so that they have predictable funding, so they are able to forecast out what their funding that's going to come in. So paying by classrooms, we feel like, is one way we can get there. And one of the ideas is, because not every family needs the same hours of care, that we would have classrooms, you know, kind of like Legos as you're building your classroom. You could have part day, you could have full day, you could have full day school year, full day all year. So we were thinking of like classrooms could be combined with this combination of blocks of time, but providers would be paid per classroom. And we think that could reduce some of the complexity and be more predictable for the providers. But it's obviously something, you know, we have to think through all of the nuances of that. I can share one of the things that came up in the public listening session was, you know, we're using the terminology of classroom. Not everybody, family childcare providers, don't necessarily use the term classroom. And so we have to be thinking about how that transitions to that field. But I think the big takeaway is to make it simpler for providers, more predictable for providers in the way we fund. So I don't know, Emily, if that answered or gave you a little bit more information about our thought behind that.
Yeah, I think that the predictability is critically important. That's certainly something that we hear with frequency as well. I just want to be mindful about what you raised. Not everybody has a classroom, and also, you know, other equity aspects of funding per class, especially if, you know, government structure is going to be kind of localized. I do think that there are it's very multi-step thinking in terms of how to make sure that you know, we're covering our bases in terms of providing the right supports and resourcing needed. That's all.
I wanted to go back a little bit to the local governance piece, right? And really thinking about, you know, what that could look like on the ground, right? And we have several approaches that are currently in place, such as school readiness councils, local early childhood collaboratives, and other tables that are set where providers, partners come to the table to better understand the needs holistically, right, within their communities, and to help do planning and make decisions moving forward. I'd like to specifically ask, I know Emily raised this around parent voice and kind of the engagement of families in that process as well, and how to think about that. And kind of what resonates with you, or what should we and do we need to be thinking about when it comes to equity at tables with voice and decisions, and especially as it relates to families or other partners that might not be at the tables currently.
Yeah, so I think the thing that I first gravitated thinking around in this was that, you know, I really do like the idea of a one-stop shop for parents as well as providers, although that wasn't necessarily the intended audience. I think, you know, parents were the intended audience for the one-stop shop. And then when you look at kind of all of the responsibilities of these kind of localized governance structure entities, funding is also part of that too. And so if I'm a parent and my pay will be impacted by the local entity or my contribution, right? I just want to make sure that there is a seamlessness about how we're kind of recreating some systems here. I'm all for making things easier for parents and providers, and I just I don't want it to create a thing and then it ends up being that actually it's more work for parents, or more work for providers in the final outcome.
Mhm.
Yeah.
Mhm. And you also raised up, we do have a new statewide, I call it new, but it's now, I think, about a year and a half into the making of a parent cabinet, right, which is a statewide kind of advisory body to the Office of Early Childhood. And so, I think as we think about parent voice and engagement and partnership, we're wanting to think about it at each kind of level of the system, right? At the local level, potentially at the regional level, and at the state level, and how each of those pieces interconnect and how those feedback loops are strong, right, amongst all of those different pieces of the system. Althea, please.
Thank you, Elena. So this is also something that I think I've spoken about, and I think I mentioned it in the meeting, and I think that was on Monday, about how this is going to be managed. I know there's been some guidelines provided around representation on these local governance bodies, and that I'm not sure. I think the response was that, the capacity for the state to really hold these entities accountable for ensuring parents' voices are there. And with equity and access being one of the things that we're focusing in on when the time these meetings are held, the location, the means of accessing them have to be also considered when we're thinking about bringing the voice of parents and caregivers to the table. With regard to also some conversation around the governance bodies being somehow funded, that maybe parents receive some form of stipend for their time. A lot of our parents are not salaried individuals where they can take time off for a 2-hour meeting and show up. It may mean missing work or work hours. So how do we consider that when we're also thinking about bringing them to the table? So that's some of what my concern is, that I think it's hugely important when we're making decisions around a variety of things at those tables. I sit on our local school readiness council. So I think, not having the voice of a parent or caregiver when decisions are being made relative to funding that can potentially impact, the care that's being provided, to their children by way of support to the individuals in those respective classroom centers, is hugely important. So I think as we think about what that funding looks like to those bodies, that we also consider what that means for the individuals showing up, specifically parents and caregivers.
Thank you.
We have just a few minutes left, and I know some of you have shared what you would prioritize, but we wanted to give other folks an opportunity. As you've shared, there's a lot in our recommendations, right? And so, and we hope that we could always do them all. But if we, what are some of the things that you as a panel think that we should be prioritizing, and what are some that just don't need that level of prioritization right now, if you were to help us and direct us in achieving some of these?
I think as we move forward, right, the panel will be recommending over a 5-year, right, period of time. So as we think about that time frame, what are the pieces that are either critically important that must be done first in order for some of the other pieces to fall in place? Maybe there's some low-hanging fruit, right, that we can move a little bit more quickly. But as we think about that 5-year timeframe, as Cathy laid out, you know, what are some of the pieces that you all think are areas where we need to be focusing on and prioritizing?
Well, Commissioner, the conversation today is restricted right to what we're talking about with supports and with funding sources. So I think we covered that. We all believe that parental voice and engagement has to remain a high priority as we go forward and make it, and the system needs to be simplified so it isn't. So I don't know how you get from that complexity to simplification, but I do believe that's crucial because we want people to be able to come in. I mean, I work with TVCCA and they have that one-stop shopping, you know, you come in and you get the whole array of services available. I think that is a goal that we have to have for the parents, that they know what's available, they know where they're eligible. So I think we cover that in this. And I just like to re-emphasize that I think that is an important piece. And again, I leave it to the people that are on the ground doing the work to help us get that piece on the funding consolidated and source how it can work. I hear today with the classroom looking at funding for per classroom that may be good. I wonder, is there a way that we won't have a pilot, so we're going to be doing this to see ultimately that these decisions really are improving the system and the outcomes. So I think this, we have a lot of lofty goals, but I would keep that high in my priority list, that we be sure that we hear from the parents. And to the last speaker, we did in the last legislative session, I think there is an awareness that we have to have parental voice on these cabinets and in governance board, and we're willing, and I'll continue to advocate that, maybe looking, if it's a transportation problem with the parents, we can continue to do work there. So I think keeping parental voice, making sure that what we do actually works. I don't know how you prove it before, but I'm glad it's a 5-year plan because it'll help us work some of that out. So I don't know if that's adding anything, but thank you.
No, but I think go ahead, Cathy, please.
Yeah, no, thank you for that. And I totally agree with you. We need to know whether this is going to work, which means we need to get the data from this, right? So is there an improvement as we go toward this type of funding for classrooms? What does it look like? Are programs better positioned to, you know, sustain their business, right? We need to see this data. But we also have to understand with any change in the system, it takes time, right? And so, you know, we've got to give it some time to adjust and measure the data, and also, you know, have those feedback loops, and do some course corrections if needed. Out of grants and contracts, we have been working with the Harvard Kennedy School around active contract management, where you use data on a regular basis to assess, you know, the function and the performance, but you know, this commitment to using data to tell the story, and be willing to make some course corrections if needed. I think is really important here. As Elena said, this is a 5-year rollout, so there'll be adjustments along the way.
Well, we're so glad we have you there, being able to monitor and do that work. Thank you for your expertise and your comments.
Thank you. Adette.
Hi, good morning. So just very, very quickly, I think that I would want to say the 3 things that are most critical out of the recommendations we saw today would be that first, to stabilize the funding so that programs can operate in an efficient manner. I think that we can't do that without making those payments in advance and meeting that true cost of care, kind of putting our money where our mouth is. And then as far as the governance structure is concerned, I agree locally, to get feedback from providers and parents, is what are their needs? Is it working for them? And then lastly, the data, I mean, we all agree that it's not where it needs to be. And then that data could be used to guide and adjust as we move forward. So I would say those three things in my mind are most critical.
Yeah. And you're raising up some really good points, right? Changes is exciting, right? But it's potentially challenging, right, as well. And so what are some of those kind of pieces that we need to have, be aware of, right, of continuing to support the field and stabilize the field as changes occur, right, and as improvements are made, as well. So one thing that we didn't hear from anybody was any reaction to a regional kind of new regional governance structure, right? So keeping the local governance bodies in place, creating regional ones where it might be potentially smaller towns, but making sure we're covering the whole state, because right now, school readiness councils, local early childhood collaboratives don't cover, right, all of the towns across Connecticut, but also adding a regional governance structure to support the local bodies as well. I guess, were there any reactions to that, or is this an area that potentially we might need to dig a little bit deeper in and share a little bit more thinking about, or generate some thinking together? But any reactions to that regional piece?
I think, if I may, I think the regional piece with early childcare is not as sensitive as it was when we talked about regionalization of the school. So I think they're two separate type of issues. And if it does help with gathering more voices at the table and not eliminating anyone, as you pointed out, in some of the smaller areas that may not have the same structure, I don't see that that should create the big issue that we had in the K through 12. So I think it's very much worthy of investigation to be sure if it's going to, as I said, include all voices and that we're on the same page moving forward. But I do think it will require additional work and study.
Yeah, I just want to echo Representative McCarty. I think that it is definitely worthy of investigation. And especially, I think if it's just focused on TA, the one kind of caveat that I assumed was included in some of the language, but just in case that it's not, because it's not explicit, is around folding in other state agencies into that space. I'm thinking, transportation specifically, but certainly, other agencies like DCF probably make good sense, but you've named them. I'm, as an extension to that thought, one of the things that always worries me about that type of regional carving out is that there's always a possibility of forgetting folks who might not be geographically included, however those lines are drawn. So I think it's just more of a make sure that we're covering the bases rather than don't do it, right? But that certainly I think is worth exploring.
Thank you. Whoop. There's our countdown. So before we leave this breakout room, want to thank you all for your contributions today and your ideas and your feedback as well. And, as always, this is not the only opportunity, and we want to hear from you. As you continue to digest this material, I'm sure questions will raise or new ideas will form. So please continuously share them with us. Cathy, any?
No, just thank you for your feedback. and your participation.
Any last comments or thoughts before we break? I think it's really exciting as these continue to gel and to form these recommendations, especially under systems. This is really, I think, where we're starting to see everything come together and really take form in the different work streams or work groups that have already presented. So, great.
And I
Kendra?
just, this is
Please.
just a very quick comment. I appreciate receiving the timeline and getting all the different dates and what the discussions will center on in each one. What's the next one that we're going to have? Is it a continuation of bringing them all together now before they go back to the for the finalization before we move forward? Just a comment to, I appreciate getting the timeline and just wondered if you had any new information going forward.
There's one more work group that will be presenting, and it is